Seniors, the checkups designed to save you before 70 can quietly hurt you after 70. Here's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they're being over-tested. One of these checkups, the number one on our list, actually causes 5% of all cancer cases in the US, which is equal to the number of cases caused by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science. Today, we're uncovering it all. The 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your body, all backed by real science. And you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test, why it looks harmless but could quietly ruin your quality of life. Number 5. Carotid artery ultrasound. Screening in asymptomatic seniors. It looks harmless, but this stroke screen often sends healthy seniors into risky procedures for nothing. Here's what happens. You go in for a routine physical, feeling perfectly fine. Your doctor hears a slight whooshing sound in your neck, called a bruit, and orders an ultrasound of your carotid arteries. Sounds reasonable, right? We're just checking for blockages that could cause a stroke. But here's what no one tells you. The U.S. Preventive Services Task Force, the gold standard for medical recommendations, gives carotid screening a grade D rating. That means they recommend against it for people without symptoms. Why? Because significant silent blockage is uncommon even in adults 65 and older. Less than 2% of the population. But false positives? They're everywhere. And once that scan shows even mild plaque buildup, which is completely normal with aging, you're suddenly labeled as high risk. What follows is a cascade of fear, more tests, and often unnecessary procedures. Angiograms that use dangerous contrast dyes, stents that carry surgical risks, even major surgery to clean out your arteries when you felt fine to begin with. Let me tell you about Margaret, a 76-year-old retired teacher who loved her daily walks. During a routine checkup, her doctor detected a bruit and ordered a carotid ultrasound. The scan showed mild plaque, nothing unusual for her age. But her doctor panicked and referred her to a vascular surgeon. Within weeks, Margaret was scheduled for carotid endarterectomy, major surgery to scrape plaque from her artery. The procedure went wrong. She suffered a small stroke during surgery and spent months in rehabilitation, all for a blockage that likely would never have caused problems. Do this instead. Skip carotid screening if you have no symptoms. No vision loss, no weakness on one side, no speech problems. Instead, focus on what actually prevents strokes. Control your blood pressure, manage cholesterol, don't smoke, and stay active. If you develop sudden neurological symptoms, then seek urgent evaluation. The American Academy of Family Physicians is clear. Don't screen asymptomatic adults for carotid stenosis. The harms exceed the benefits, especially after 70. Number 4. Resting EKG treadmill stress test. Heart screening without symptoms. A routine heart check can brand you a cardiac patient and push you onto the catheterization table when you felt fine. This happens thousands of times every day across America. Seniors go in for annual physicals, and doctors order baseline EKGs or stress tests just to be safe. But here's the uncomfortable truth. These tests in healthy, asymptomatic seniors cause more harm than good. The American Academy of Family Physicians, through their Choosing Wisely campaign, explicitly states, don't perform annual EKGs or stress tests in low-risk, asymptomatic adults. The harms exceed the potential benefits. Why? Because false positives are incredibly common. Your heart might show a tiny abnormality that means absolutely nothing, but once it's on paper, you're labeled as having heart disease. What follows is a medical cascade that's hard to escape. More tests, stress tests that can trigger actual heart problems, cardiac catheterizations, where they thread tubes through your arteries that carry real risks of bleeding, kidney damage from contrast dyes, and even heart attacks. A major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit. These patients had no improvement in survival or quality of life after the procedure. What they did have were higher rates of bleeding, kidney injury, and prolonged hospital stays. This happened to Robert, a 74-year-old retired postal worker who stayed active by walking every day. During a checkup, he mentioned he sometimes felt tired on hills. His doctor scheduled a stress test, just to be sure. The results were unclear, so he was sent for catheterization. A mild narrowing was found and a stent was placed. But that night, Robert had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and needed follow-up care for weeks. The fatigue never changed because it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and more rest between activities. Do this instead. If you're over 70 and not experiencing classic cardiac symptoms, chest pain during activity, shortness of breath on exertion, or significant drops in energy during light exercise, then a stress test may do more harm than good. Focus on proven prevention, regular walking, heart-healthy eating, blood pressure control, and cholesterol management. If you develop concerning symptoms, then pursue testing with clear goals and understanding of what comes next. Number 3. Colonoscopy. Colorectal cancer screening. The gold standard turns risky in the golden years. Complications rise, benefit shrinks. You probably didn't expect this one. Colonoscopy, the procedure that uses a long camera to examine your colon, is not always a wise choice after age 70 and almost never recommended after 75 unless there are specific symptoms. Here's what changes as you age. The risks go up dramatically while the benefits plummet. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues in seniors. The sedation used during the procedure poses added risks to brain function in older adults. And perhaps most surprisingly, the test itself can cause complications like bleeding, perforation, or even heart rhythm disturbances during sedation. The U.S. Preventive Services Task Force gives colonoscopy screening an A rating up to age 75, but from 76 to 85, it drops to a C, meaning they recommend it selectively based on overall health, prior screening history, and patient preferences. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved. But over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. But her new primary doctor, fresh out of residency, urged her to get a screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation. She spent 9 days in recovery, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already had 2 clean colonoscopies in the past. There was no reason to repeat it. Do this instead. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health between 76 and 85, consider non-invasive alternatives like the FEIT test, a stool-based test done at home with no prep, no sedation, and it still catches most concerning cases. Always ask, given my age, health status, and prior results, what happens if this test finds something? Will treatment actually improve my life expectancy or quality of life? Number 2, mammogram, breast cancer screening after 75. After 75, up to half of cancers found may be ones that would never hurt you, but the treatments can. This might shock you the most. Mammograms, X-ray screening that's proven beneficial for women aged 50 to 74, become increasingly problematic as you get older. The U.S. Preventive Services Task Force states that evidence is insufficient to assess benefits and harms for women 75 and older. Translation: routine screening is not recommended beyond 74 based on current evidence. But here's the truly disturbing part. A National Cancer Institute analysis found that in women aged 75 to 84, approximately 47% of screen-detected breast cancers are overdiagnosed. That means they would never have become symptomatic or life-threatening during the woman's remaining lifespan. For women 70 to 74, the overdiagnosis rate is still 31%. These are cancers that would have remained dormant, but once found, they trigger the full treatment cascade: biopsies, surgery, radiation, chemotherapy. The physical and emotional toll is enormous. Lymphedema from surgery, fatigue from radiation, nausea from chemotherapy, anxiety and depression from a cancer diagnosis, all for tumors that likely would never have caused problems. But the medical system doesn't distinguish between aggressive cancers that need treatment and indolent ones that don't. Once cancer is detected, the treatment machine kicks into high gear. I'll never forget Helen, a vibrant 77-year-old who volunteered at her local library and traveled with her book club. Her routine mammogram detected a tiny tumor, less than 1 centimeter. She underwent lumpectomy, radiation, and hormone therapy. The treatments left her exhausted and depressed. She stopped volunteering, canceled her travel plans, and spent months recovering from treatments for a cancer that pathology later suggested was extremely slow-growing and unlikely to have affected her lifespan. 2 years later, she told me, "I wish I had never gotten that mammogram. The treatments took away 2 years of my life for something that probably would never have hurt me. Do this instead. If you're well over 75 or have multiple health conditions, consider stopping routine mammography and shifting to symptom awareness and clinical breast exams during regular checkups. If you're 75 to 79 and in excellent health, have a detailed discussion with your doctor about your personal risk factors, family history, prior breast biopsies, breast density, and make a shared decision. Always ask, if this mammogram finds a small tumor, would finding and treating it actually change my life expectancy, or would it just add treatment harms to my remaining years? Number 1. Annual full-body CT scans. Full-body CT scans, sometimes offered as part of executive health packages or preventive services in private clinics, are marketed as a way to catch cancer early. But here's the shocking truth. These scans expose your body to massive doses of ionizing radiation. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is incredibly high. And the irony? There is zero evidence that full-body scans without symptoms save lives. Each scan delivers between 10 to 20 millisieverts of radiation, equal to around 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the rise in CT scans across the United States may now be responsible for up to 5% of all cancers. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scans detect harmless nodules, calcifications, and cysts that are simply part of aging. But the moment they're seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marcus, an active 80-year-old who used to teach martial arts to younger seniors. He felt great and participated in a senior elite checkup at a private clinic. His full-body scan showed a tiny 3mm lung nodule. That set off a chain reaction. He was referred to oncology, sent for a PT scan, and eventually underwent a needle biopsy. The result? Benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery, all for something that could have been left alone. The American College of Radiology is crystal clear. There's no proven benefit to full-body CT screening in asymptomatic adults, and there's significant potential for harm. But here's what makes this the most dangerous checkup on our list. Unlike the other tests we've discussed, full-body CT scans are often cash pay services marketed directly to consumers. There's no medical oversight, no consideration of your individual risk factors, and no discussion of what happens if something is found. You walk in healthy and walk out with a radiation dose equivalent to surviving the atomic bomb at Hiroshima from 1.5 miles away. And for what? The chance of finding something that probably doesn't need treatment, but will definitely cause anxiety, more tests, and potential complications. Do this instead. If you feel well, maintain regular checkups with your primary doctor and only pursue imaging that's clearly indicated by symptoms or risk factors. If there are concerning symptoms, unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes sense. But scanning your whole body with no focus is like searching for treasure with a landmine detector. You might find something, but the damage could be worse than what you were trying to avoid. Quick reference guide. So there you have it, 5 checkups that may seem helpful, but can actually hurt, especially once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. The key is asking the right questions. What happens next if this test finds something? Will treatment actually improve my life expectancy or quality of life? Are the risks of the test itself worth the potential benefits at my age? Remember, real prevention starts with lifestyle. Stay active, eat well, sleep deeply, manage stress, and choose your checkups wisely. Don't let fear drive you into unnecessary testing that could leave you worse off than when you started. The most important thing to remember, you have the right to say no. You have the right to ask questions. You have the right to seek second opinions. Your body, your choice. Especially when the evidence shows that more testing isn't always better testing. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences in the comments below. We read every single one and often reply with additional resources. And if this video opened your eyes to the reality of over-testing in seniors, please share it with someone you care about. After 70, every medical decision carries more weight. Make sure your loved ones have the information they need to make informed choices. Thanks for watching, and remember, this is educational content, not medical advice. Always discuss testing decisions with your healthcare provider, considering your individual health status, family history, and personal values. We'll see you in the next video where we reveal the 5 medical tests that seniors actually should get regularly. Tests that can truly save your life when done at the right time and frequency.